Hi, dear friends, welcome back to Health Fitness by Sharath. Alright, welcome to a lesson on diabetes, otherwise known as diabetes mellitus, is a metabolic disorder in which your body cannot properly store or use fuel for energy. The fuel that your body needs is called glucose or sugar. Glucose comes from foods such as breads, cereals, pasta, rice, potatoes, fruits, and vegetables. And it's also made in your liver and muscles. Your blood carries glucose to all of your body's cells to use for energy, to use glucose. Your body needs insulin. Insulin is the hormone made by a gland in your body called the pancreas. Insulin regulates blood glucose. By stimulating the removal of glucose from the blood and its uptake into muscle, liver, and fat cells where it can be stored for energy. Sometimes your body does not make enough insulin, or the insulin does not work the way it should. Glucose then stays in your blood and does not reach your cells. Your blood glucose levels get too high, which is hyperglycemia, and can cause diabetes or prediabetes. Prediabetes is when blood glucose levels are higher than normal, but not quite high enough for a diagnosis of diabetes over time. Having too much glucose in your blood can cause health problems. There are two major causes of this metabolic disease. Your body makes too little or no insulin. This is called type 1 diabetes or insulin dependent diabetes, where your body cannot use the insulin that it makes. And this is called type 2 diabetes or non-insulin dependent diabetes. Insulin resistance is a condition in which the body's cells become resistant to the effects of insulin. That is, the normal response to a given amount of insulin, it is reduced as a result. Higher levels of insulin are needed in order for insulin to have its proper effects. So the pancreas compensates by trying to produce more insulin. This resistance occurs in response to the body's own insulin, or when insulin is administered by injection with insulin resistance. The pancreas produces more and more insulin until the pancreas can no longer produce sufficient insulin for the body's demands. Then blood sugar rises. Insulin resistance is a risk factor for development of diabetes and heart disease. Diabetes is serious and can cause memory loss, panic, anxiety, weight gain, high cholesterol, eyesight, and peripheral neuropathy. It's a very serious, so there's a very simple at-home test that you can do to check your blood sugar, and it's called blood glucose monitoring. Get yourself a glucometer and test strips. You can find these at any pharmacy or even online on Amazon.com. They're pretty inexpensive, and most of the time, your insurance will cover them as well. All you do is prick your finger. Don't worry, it doesn't hurt, and test the drop of blood to check your blood glucose. You can do this first thing in the morning, which is your fasting blood glucose, and also do an hour after every meal. This will show you how your meals are working for you. The normal range is between 70 and 100. Under 70 is a sign of hypoglycemia or low blood sugar, and over 100 is hyperglycemia or high blood sugar, and both can be problematic. You want to be in the range at all times, and if you're not, you may not be eating the right foods. Only 5% of people with diabetes have type 1. Type 1 diabetes is an autoimmune disease that may be caused by genetic, environmental, or other factors. Type 2 diabetes accounts for 90 to 95% of diabetes cases and is usually associated with older age, obesity, and physical activity, family history of type 2 diabetes, or a personal history of gestational diabetes. There is no known way to prevent diabetes. Type 1 effective treatment requires the use of insulin. Type 2 diabetes can be prevented through healthy food choices, physical activity, and weight loss. Some healthy choices for the prevention or to maintain healthy blood sugar, even if you've already developed type 2 diabetes, are slow-releasing carbohydrates like sweet potatoes, lentils, split peas, brown rice, and Kiyama quality protein, like grass-fed, beef free range, chicken, fish, and eggs, fats like avocados, nuts, coconut oil, and olive oil. These are going to keep your blood sugar balance low. Sugar fruits like berries. Try not to consume too many other fruits that are high in sugar like watermelon, oranges, and pineapple. Fish oil protects the brain and eyes from degeneration that can happen from chronic high blood sugar. Cinnamon balances your blood sugar for up to 24 hours. It's so powerful. Cinnamon is so great to keep steady blood sugar levels. You can just add half a teaspoon to your oatmeal coffee or a smoothie in the morning. This is so easy to do. And raw coconut sugar has a much lower impact on blood sugar compared to regular sugar. So use this as your sweetener of choice. Or you can always use stevia as well, which has no impact on your blood sugar. Here's some supplements great for diabetes. Numerous studies have been done to show positive results with Chromium Pico and the prediabetes. One of these studies in 1997, study involving 180 type 2 diabetes patients in China, is a classic. It documented spectacular results in diabetes patients who took 500 micrograms of Chromium Pico and ate twice daily after 4 months. Nearly all of the diabetes patients no longer had traditional signs of diabetes. Their blood sugar and insulin levels dropped to near normal, something that medications could not achieve. Even more importantly, the gold standard diagnostic measure of diabetes blood levels of hemoglobin A1c, which are sugar-damaged proteins that age cells, also dropped to normal magnesium. There's a book called The Magnesium Miracle by Dr. Caroline Dieng, an MD and naturopath. According to Dr. Dean, nearly 80% of Americans are deficient in magnesium, and it is often the primary factor in heart disease, high blood pressure, diabetes, and most muscular problems. Magnesium is needed for more than 300 biochemical reactions in the body. It is involved in energy metabolism and protein synthesis. Results from 3 very large studies indicate that people who consume a diet rich in magnesium have a lower risk of getting type 2 diabetes. People with diabetes are more likely than those without to be low in magnesium. According to an article on about.com, elevated blood glucose levels increase the loss of magnesium in the urine, which in turn lowers blood levels of magnesium. So getting enough magnesium is especially important in diabetes. 400 to 800 milligrams before bed works wonders for blood sugar control, as well as aiding in solid sleep. DHA can restore insulin sensitivity and reduce cardiovascular disease. It is common knowledge that people with type 2 diabetes are at increased risk of cardiovascular disease in the late 1980s. Researchers began to identify the use of dietary supplements with fish oil as one method to treat the typical slipdemia associated with diabetes. While animal fats are high in saturated fats, fish oils are high in polyunsaturated fats, specifically omega-3 fatty acids. Over the past few decades, many studies have shown some benefit to the addition of omega-3 fatty acids, and new studies continue to be published today, solidifying the fact that they may have some benefit in reducing cardiovascular disease. A new study published in Diabetes Care also revealed that increasing fish intake and subsequent omega-3 fatty acids can also reduce the risk of type 2 diabetes in men. Vanadium is a trace mineral that is found in many foods and has been shown in a few studies to increase a person's sensitivity to insulin. Several animal studies and a few very small human studies suggest that vanadium may lower blood sugar levels and improve sensitivity to insulin in people with type 2 diabetes. In one study of people with type 2 diabetes, vanadium also lowered their total and LDL cholesterol, and cinnamon cloves, cardamom, and dilla have all been shown to help lower blood glucose levels in people with type 2 diabetes and avoid artificial sweeteners at all costs. These include sucralose, aspartame, and saccharin. It can be tempting to use these in an attempt to control blood sugar levels. And because the food industry and medical establishment have heavily promoted it for diabetes patients. However, they are detrimental to your health. The sweetness tricks your body into anticipating glucose coming in, and so it releases insulin in response. This can lead to insulin resistance and weight gain since insulin is the body's #1 fat-storing hormone. They're all bad, but aspartame is connected to brain problems, toxicity, and seizures. Do not consume it. You can sweeten it with honey, natural stevia, xylitol, or raw coconut sugar. Just don't go crazy with the honey. Stevia has zero impact on blood sugar. Xylitol has extremely low impact on blood sugar, and coconut sugar has very low impact as well. I hope you found some good takeaways from this lesson on diabetes.